Hello, everyone. My name is Hilton Silva, and I am talking from the Universidade Federal do Pará in Belém. This is a work done jointly by our team and also the research team from the Universidade Estadual do Pará, by myself and Ariana Kelly, Lígia Filgueiras, and Rosiane Tavares. The work that we'll be talking about today is called Structural Racism and the Impacts of the COVID-19 Syndemic among Quilombola populations of Brazil. This is a work done to try to bring attention to the impacts of the disease among these populations. The new coronavirus has affected disproportionately the Black population in Brazil, as has happened in the United States, in England, and in many other places where the most vulnerable populations have been affected the most by the pandemic. Among the Black populations of Brazil, the Quilombos are part of these groups. They are composed mostly of descendants of Africans who were enslaved and brought to Brazil and then run away from farms and plantations and formed centers of production and social organization throughout the country, starting in the 17th century and persisting to this day. They are present in all regions of the country, especially in rural areas, but there are also some in the urban areas, especially in the Amazon basin. And they still maintain some degree of geographic isolation, most of them, leading to limited access to health services, even those provided by the unified health system in Brazil, and high levels of poverty and chronic and infectious diseases. About 5 million people were brought from Africa to be enslaved in Brazil between the 16th and the 19th centuries. And these were enslaved for over 300 years until the formal abolition of slavery in May of 1888. Brazil was the last country in the Americas to abolish slavery. And this is a process which still has impacts in our country today. Currently, there is no official information about the number of quilombolas in the country because they were never included in the census as a special group. But their national organization called CONAC estimate that there are over 6,000 quilombola communities throughout the country in most of the states, as it can be seen in this figure. In our state, Pará, there are about 528 quilombola communities, and we have worked with many of them in the last 10 years. Among the quilombolas, the structural racism pervasive in the country contributes to reduced quality of life, to high rates of hypertension, diabetes, intestinal parasites, respiratory illnesses, sickle cell disease, misdiagnosis, and wasting and stunting, among other problems, of which we have investigated and found in all the communities that we have worked with, and that of which there are many reports in Brazil. With the arrival of COVID-19 in March of last year, pre-existing diseases, these pre-existing diseases increased the impact of the virus, leading to a rate of mortality up to 4 times higher than that observed among the white population of Brazil. In fact, this is among the highest rates of any population in the country. As you can see in this table, this is data from our research. there is a high prevalence of pre-obesity and obesity among the Quilombola adults, almost as high as what you see in the urban areas of the country. And there is also a high rate of reduced glucose tolerance and diabetes in these groups as well, both in males and females. But in both cases, both in case of obesity and in case of diabetes, usually the women are more affected than the men, and they are also affected earlier than the men. So the compound effects of the new virus, the existing diseases, as we have seen, and the social conditions demonstrate a clear syndemic relation in these populations, which has still not been properly addressed by the public authorities in the country. More than 50% of the population in Brazil self-declares as Black and brown. Brazil is the country with the highest percentage of Black population outside of Africa. However, most of the Quilombola communities are still not officially recognized either by the state or by the federal government, which is another problem, as these people depend mostly on agriculture for subsistence, and their lands are constantly threatened by invaders, especially in the Amazon basin, but also in the southeastern part of Brazil and in the south. Overall, the Black population in Brazil has received less resources to the treatment and management of the disease. They have received less vaccines. Some research in São Paulo shows that up to 50% less vaccines than the white population. And when they are hospitalized, they have a higher rate of mortality than the white population, which is, makes it very clear that there are very important racial disparities in the country. When we go to the field, and this is a picture taken before the pandemic, we usually help these groups in terms of providing them with diagnosis and sending them to the unified health system for treatment and explaining to them what they have and so on and so forth. With the advent of the pandemic, the field research was also reduced, or in some cases ended completely, which is an added factor in terms of reducing their access to healthcare services. The high frequency of COVID-19 cases in these afro-derived communities is clearly associated with the social determinants of health, as we have seen. And because of that, it is necessary that they receive special treatment, and we are in fact fighting with the government to provide them with easier access to vaccines, just as what happens with the Native American populations. The combined effects of disease, structural racism, reduction in the support to the unified health systems, to cuts in funding, and the emerging infection, SARS-CoV-2 or COVID-19, have increased the health and the social disparities in the country, as it has happened in many other countries as well. And this will bring, for sure, long-term consequences for the Afro-Brazilians in general, as they are subject to worse health situation overall, and especially to the Quilombolas, which in general have worse markers for any kind of disease that you look at, or any biological factor that you look at, only a little bit better than what happens with the Native American populations. And that's why they are highly affected by this disease. I want to thank you all for coming and watching this presentation, and we continue to fight for the improvement of the health of the Quilombo populations and to better management of the unified health system in Brazil. Thank you very much.